Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County League of Women Voters, one of the civic partners for our show. My guest today is Kate Favreau from the St. Lawrence Valley Hospice, and she's their outreach coordinator. She's here to talk to us about advanced health care and funeral planning. Kate, welcome back to North Country Matters. We're continuing our series with hospice, and today's topic is not one that a lot of people want to have to think about. It makes us pretty uncomfortable, doesn't it?
It does, unfortunately. I think as a culture, we're pretty death avoidant. So when it comes to even things like advanced care planning and funeral care planning, um, we tend to not want to talk about it, but it is going to impact all of us eventually.
Yes, you're exactly right. So let's talk about a way to think about advanced care planning that takes some of that discomfort away. How can we frame this topic in a more positive way?
So this is actually something that I learned watching my grandma age and come onto hospice. So as people age, they tend to lose autonomy. So they lose the things that they can control in their lives. Advanced care planning truly is just a way to guarantee your autonomy. If you make the choices that you want for your care ahead of time, then if there gets to be a point where you can't verbalize those choices, you've already exerted that control. So you know that what you really want is going to be enacted, even if you can't say so.
And the other thing, of course, that by doing that and having those conversations with your family is you take away a lot of the uncertainty that they're feeling. Not everyone is not always sure about what that loved one exactly wants. So having that conversation takes away a lot of that unknown, doesn't it?
Absolutely. Yes. And as like a grief support person afterwards, I can tell you that families who knew for certain that they were making the right decisions because they'd already been made for them, their grief process is always a little easier.
That's a very good point. So let's talk about the a number of important aspects to the advanced care planning. Let's go some of the key pieces that folks should start thinking about. What comes under the topic of advanced healthcare planning?
So advanced healthcare planning, I think the easiest and quickest place to start is identifying what's called a healthcare proxy. So a healthcare proxy can be any adult over the age of 18 who you have designated as your person that's going to make healthcare decisions for you if and only if you, the patient, are non-decisional. So if you are not alert and oriented to person, place, and time, this person is going to make decisions for you, hopefully akin to the decisions you would have made for yourself, to make sure that you get the care that you want, even if you can't say so for yourself. And that's really easy. That's just any adult. And, if you pick your favorite sister and then you have a falling out with your favorite sister, you can just update it. It's very simple.
I want to mention something that happened in my own family. My aunt had a healthcare proxy, but she ended up in Burlington, Vermont. And Burlington did not respect the fact that she had a New York State healthcare proxy. So it made some of the decision making very difficult for my cousin who was there to help her, and my aunt was no longer able to make those decisions. So thinking about that ahead of time and making sure that if you're not in your home state, that you take care of that before you end up in the hospital is important, isn't it?
Yeah, absolutely. I haven't heard that one before, but yeah, definitely have something in place to make sure that that is covered as well.
Okay, so then you also talk about the yellow dot program. What is that?
So I had no idea that this existed. The Yellow Dot program is a program that's sponsored by the Sheriff's Association of New York State, and it is simply a yellow dot sticker and a yellow envelope. And you would put this yellow dot sticker on the rear driver's side window of your vehicle, and that will signify to first responders that in your glove box they will find said yellow envelope. And that yellow envelope will contain the name and the contact information for your healthcare proxy. That will contain your name and vital stats as the driver. That will contain, hopefully, if you have a MOLST, it could contain a copy of that. But it would also contain information about any allergies that you have to medications or any long-term chronic health conditions that first responders might need to know about. So if there is a car accident and you have really clear desires that you've expressed for healthcare planning purposes, they know where to find that right on scene. It also applies in your home. So you would put the second sticker that you get on the main door to your home, and that'll signify to first responders that that same information can be found in your freezer.
Wow, that is such good information and two really important considerations because, as we know, car accidents can end up with people not being able to respond at all to what their current situation is. So that is great information, and it also helps the first responders make good choices, doesn't it?
Absolutely. Yep.
Well, and the other thing that you mentioned was the MOLST. And so let's go through what the MOLST is, because that's another program that a lot of people may not be that familiar with.
Right. So a MOLST stands for Medical Orders for Life-Sustaining Treatment, and this is a doctor's order. So this is not something that you're just going to do at home. This is a conversation that we really encourage you to have with your primary care provider, or if you're seeing any sort of specialist, with that individual. This covers a lot of different steps for advanced healthcare planning. I'm going to start at the bottom of what it covers and go up. So that's how we do it with our patients. We start with the least invasive and we go from there. So at the very bottom, this MOLST, this form that's a medical order, is going to talk about dialysis. If you get to the point where your body needs dialysis to sustain life, do you want to do that? Do you want to try it for a certain period of time, or do you not want to do it at all? Moving up the list, we get to antibiotics. So if you get an upper respiratory infection or a urinary tract infection, do you want antibiotics to treat that? Again, do you want them? Do you want to try it for a period of time and see if it helps, or do you not want to try it all? Further up, you get to feeding tube options. So if you get to the point where you need a feeding tube to continue to get nutrition, do you want that? Do you want to try it? Do you not want to try it at all? In that same vein are IV fluids. Do you want to try that for a period of time or not at all? And then we get to treatment guidelines. So this is where you come into the comfort care, where people start to hear that a lot. So do you just want to be kept comfortable? Do you want people to be doing different types of procedures on you to sustain your life, things like that? And then we get to transfer to hospital. So if you are in a position where your pain is out of control or your symptoms are out of control, do you want to be transferred to the hospital for pain and symptom control? Would you like to remain at home? Do you want to go to the hospital no matter what? And then at the very top, you have your DNI, so your do not intubate. If you have a pulse and are breathing, do you want to be intubated? Do you want to try that for a period of time? Do you not want to try at all? And then the DNR. So if you do not have a pulse and or you are not breathing, do you want to be resuscitated or do you want natural death to occur? So it's a lot, but that's why you really need to go over it with a doctor because that is their medical order.
Wow, I guess that's very it's a very complex set of choices, isn't it? And it's not
It
the sort of
absolutely
thing
is.
that you can just roll off your tongue and say, "Oh well, I want A, B, and C, but not D." Yeah, so there's a lot of thinking and a lot of consultation that goes into that, isn't there?
Yes, absolutely. And a physician is going to be able to walk you through it step by step. Our staff also can walk you through things like that. Even if you're not coming on to hospice, even if you just want to learn a little bit more, our staff is also able to do that. So,
Yes, and that really is that's such a gift to be able to do a little bit of homework ahead
yeah.
of time so that you can make informed decisions, but not be overwhelmed with all that information at one time because that's too much to make all those decisions in one fell swoop, as we say.
Oh,
So
absolutely.
so in the at the point where all of that has taken place, and you know exactly how you want to go out, so to speak. Now let's turn to the after death care planning because you can actually plan for that as well, can't you?
Absolutely. So the first thing that people think about when they think about after death planning is organ donation. I was surprised to learn in New York State that regardless of your decision to donate your organs, if you die in a hospital in New York State, your family is going to get a phone call from the eye bank specifically asking about your corneas. I had no idea that that was a separate situation until I learned it in this job. I think that's important for people to know ahead of time because you may have already said no to organ donation, but you're still going to get asked another question. It's not that they didn't listen, it's just that we handle it differently in New York State.
It's a separate thing. And if I'm not mistaken, that decision, that organ donation comes out of Albany.
Yes.
So that is another consideration, which is if you don't live in the Albany area, you're talking about a time delay, aren't you?
Right. Yes. Yep. So
So
there's that goes into play as well.
it does, and it may be one of those, it may be one of those things, you know, God forbid it's a snowstorm or a holiday weekend or anything else, because all that complicates getting a decision and an eye enucleation out of Albany, doesn't it?
Yes. Yep.
So, so another good conversation to have with your family ahead of time.
Absolutely. Just ahead of time, so they're not taken by surprise.
That's right. That's right. So, one of the hardest conversations for a lot of people to have is with their family members is what they want to happen to their body after they die. What are the choices that people have here? Because it's a pretty broad range, isn't it?
Absolutely. And recently, the options have kind of exploded, right? So there are a lot of choices from here on out. Traditional burial, that's still an option for sure. A lot of people are still very traditional up here and they go with something like that. Cremation has become more and more popular and mainstream at this point in our timeline. And that's pretty basic. A lot of people know the basics of that. But then there's something called aquamation, which is what I would like done. Hopefully, we have the technology up here by the time that is needed. So that's just cremation, but with water. So it's just gonna swirl around. There's some chemicals involved, and you just disintegrate into very fine sand. The other option, which was incredibly popular when they opened green burial sites in the Potsdam Cemetery, they sold out almost instantly. Green burial is just your body in some cotton or some muslin, and you're in the ground, and we just let the decay happen like it naturally would. And the other option is called human composting, and that is legal in New York State. I believe the nearest facility to us is Saratoga, and your body would go down, they'd put it in an aerator, they would let the natural process take place, and then your body is returned in the form of very rich soil to your family. So if you're a gardener, that may be the way that you want to go because you truly can be in your garden.
Well, there are a lot of choices, as you say, and it certainly isn't as straightforward as it used to be by any means. So that's good. And goodness knows, no one heard of green burials even 10 years ago. So who knows where we're going to go in the future with all of these things. So,
Yeah, I don't know. It's exciting. Well, I don't know if exciting is the word, but it's interesting.
and none of us are in a hurry to get there.
No.
So, of course, you can also make choices about the kind of funeral or memorial service you would like. And here the choices have expanded greatly as well, haven't they?
Absolutely. So it used to get a very traditional, you get two sets of calling hours, you do a funeral mass the next day, and then we're following that right up with a burial. Now it can look kind of any way you want it to look. And you can really plan it down to the T. My mom has this habit of she'll hear a song on the radio and she'll be like, play this at my funeral. At this point, this woman's playlist for her funeral is like 4 hours long. So we might need to trim it down a little bit, but that's important to her. She wants to control the music. Other people want to have people realize that this is a celebration of life. It's not about being sad. Yes, we miss this person, but we want people to attend the service and be a lot happier than they typically would be. Some people are still very traditional and they do want those calling hours. Some people absolutely do not want calling hours. If your family doesn't know ahead of time, then they don't know the decisions to make. So really express that to your family. It can be an awkward conversation, but I think my personal approach is, hey, this is awkward, but here's what I want to happen at my funeral. We're not expediting the process. We're not making that happen any faster by having those conversations. You're just making it easier for when those conversations are necessary.
That's true. And one of the saddest things for a family is when they don't really know what the person wants and they go ahead and make a decision and then afterwards they kind of second guess themselves. Say, I'm not sure that was exactly what mom or dad or grandma or whoever was wanted because they hadn't had those conversations ahead of time. But one of the things these are so personalized now. Services are so personalized that it can really be an expression of who you are, what you were interested in your mom's case with the music. My husband and I talk about this all the time. He says, "Well, don't play that." Excuse me. So, it's really interesting. And the other thing, of course, is you can decide who you would like. What you can be a wide open, anybody could speak, or you could pick someone to speak at your funeral that knew you really well. I know a case of a very dear friend of mine a few years ago. Um, Her daughter had asked me to speak at her funeral, and I was one of four people, and each one of us took a different part of our friend's life and how we knew that person and how they impacted us. And so at the end, that service was so personalized, even though it was held in a church in a traditional way, it was a very personalized service because we all had shared something very unique about our friend and how she had impacted us. And that was not only satisfying for the family, but it's satisfying for you as the mourner and missing your dear friend. So,
Absolutely. That was a beautiful way to pay tribute to your friend. That was
well,
good.
it is. And the other thing, of course, is that it helped me through my grief process. So, and even
Yeah,
though my friend was in her 90s, I had known her for a long time and we had worked together for a long time. And so it was really, it was a tribute.
yeah,
And that is what we like to have. Our last words should be tributes.
absolutely.
So one of the most creative final parts of this process is the choice to write your own obituary, or at least make sure the parts of your life that are important to you are part of your written legacy. Let's talk about that because that's something the hospice has held uh, classes on, hasn't it? How to write an obituary.
Yes, absolutely. That's one of my favorite classes to do is how to write your own obituary. And really, at the end of the day, we want to see obituaries that are highlight reels, not resumes. So I appreciate that a lot of people get a lot of purpose and meaning out of their job. But when I read an obituary, I want to know if you made the best chocolate chip cookies in the family or if you only thought you made the best chocolate chip cookies in the family. I want to know what your superpower was. Did you always know the exact right size of Tupperware to pick for the leftovers? Because that's an amazing superpower. I know someone with that superpower. It's amazing. I want to know the little details. If you are leaving your own written history of what you want the world to remember about you, it's going to go far beyond what's called a biographical sketch, which is just born to these parents on this date, grew up here, went to school here, did this for work. Maybe we get a couple sentences about what they like to do outside of work and then who they're related to. If you write your own obituary, you get to tell the story that you want people to hear, which I think is amazing. You also, it is your last chance to give people the advice that they've been avoiding for years, right? Like this is truly the last chance for you to drive it home. And my favorite part about writing your own obituary is that you get to include your pets. And I see that more and more in the obituaries in North Country now. Like people are including their pets because they're such an important part of the family. And I absolutely adore that. The other thing is that you get to pick the picture that runs with your obituary. So I have two obituaries written. I have one as if I were to die on the way home this evening, and one as if I were to die when I'm 100. Both include my pets, and both include a picture that I know my mother would not pick for me. But it's perfect. Like it is the essence of who I am. But I know that that's not the traditional photo that would run with an obituary. So you also get to personalize it to that degree as well.
I know exactly what you're talking about when it comes to pictures. And sometimes you'll see a picture of someone who's in, as you say, nearly 100, and the picture that runs is their high school picture. And you think, well, they haven't looked like that in 80 years, you know? So, and I think, when you look at the picture of an older person and they've got lines on their face and their hair is gray or they're bald, that's their life story. You wear your life story on your face, and it certainly you have more life at the end of your life on your face than you did when you were 18 years old graduating from high school. So I think you make a great point there about getting to pick your own picture. And
Mhm.
people do have a tendency to want to sanitize um, your life and your face.
Mhm.
If you write your own, then you get to tell your story the way you want to. And there is nothing more interesting than reading a good obituary. So,
Truly. And
you
there are
know,
some gems that run in North Country now. I read the obituaries every day, and some of them I read and I'm just like, man, I wish I'd known that person.
that's right. That's right. I'm sorry I didn't know that person when they were alive because they had a very interesting life. And look at the impact they had on their community.
Mhm.
And, the old saw about at the end of your life, nobody says, gee, I wish I'd worked more.
Truly.
So,
Yes.
so anyway, that's something to think about. And you do help people with that process if they need it. So, getting started can sometimes be hard, and it's going to take time to do a good one. You're not going to be able to summarize a life in sitting down in half an hour. So don't
No,
think it's going to be a short process, right?
no, definitely not.
All right. So, as always, hospice is here to help us and you and your family through the difficult end of life, which comes to all of us. Talk to us, Kate, about the holistic way that hospice approaches this and how you tailor each experience for the people going through it to meet their needs. Because there is no one size that fits all at hospice, is there?
No, absolutely not. So we at hospice know that every life is different and the same goes for every death. So every death experience is going to be very different. And we are there to help not just the patient, but also their family through everything. And I think that's the biggest difference between someone who has the ability to die on hospice versus someone who maybe dies in a hospital or doesn't make it onto hospice before they die. There is follow-up grief support for your family after you've died. And I think that can be incredibly impactful. And holistically, hospice is not just about the physical aspects of dying for the patient. It's the physical aspects for the patient, but it's also the emotional aspects, the spiritual aspects, the community aspects, all of that together. And we support all of it through our interdisciplinary team. So it's not just a nurse that's coming to visit you. Our nurses are wonderful, but they're also in there with our social workers, our spiritual care coordinators, our volunteers. They are all there to support not just the dying patient, but their family as a whole. And we don't go away after the person has died. Like I said, we're still there for grief support. So I think that's incredibly important.
It is important. And in fact, a lot of that support can go on for months, can't it?
Yep,
There's
up
no
to
real
13
time
months.
frame that somebody says, well, all better now. I don't need you. They may need you for a long time, and they can
Yeah,
pick up a phone call and make a phone call, right?
absolutely.
Yeah.
Yes. And even if your person was not on hospice, we do have a community bereavement program. So if you didn't have any ties to hospice, you can certainly still call. You'll talk to me, and we'll figure out how to get you the support that you need in your grief.
That's such an important service that you offer. And it's one that I don't think, unless a family has been through it, you don't really understand how important it is and how much it's needed. So thank you for doing that. So, Kate, let's remind folks how to get in touch with Hospice of the St. Lawrence Valley as we get ready to close out the show because you are there for whoever needs you, whenever they need you, aren't you?
Yes, we are. So if you're not a hospice patient, but you're interested in learning more about hospice or you think you're ready for that type of care, you can give us a call anytime, day or night, 315-265-3105, and just ask for our admissions person and they'll get you set up with that. If you're looking for something like grief support, we're here Monday through Friday. That same phone number, 265-3105, and we will get you connected with the support that you need. If you just have general questions, we're also here for that too. There's no question that we haven't heard before, and if we haven't heard it before, we'll get you the answer.
That's good to know because every once in a while it does feel like there's something new under the sun, right? Thank you so much, Kate, for coming in today and talking about all these difficult things because the more we think about them ahead of time, they are less difficult to deal with, aren't they?
They are. Yep. Addressing it head on makes it a little easier.
It does. And the comfort that it gives to the family later on, it can't even be estimated because it takes all the mystery away from what did this person want? Now I know. So thank you for coming in and for giving us all this good information and for the incredibly important work that you and your colleagues do every day out there at the hospice of St. Lawrence Valley Building. We're very appreciative as a community.
You are very welcome. We're happy to be able to help in some of the hardest times in people's lives.
Yes, and it's much appreciated. So these conversations are a production of North Country Matters. This show is a civic collaboration between the League of Women Voters of St. Lawrence County and the Potsdam Public Library. Until next time, remember, our North Country matters.